So we've talked about what the different options are. So what of the three, of methadone, buprenorphine, or Vivitrol, which of those three options do you think would be a good choice for you?
So I'm kind of nervous about the withdrawal symptoms. I mean, I don't want to feel sick. That's why I use every single day. So, and I'm not interested in going somewhere every day to pick up a medication. So I think maybe the buprenorphine might be something I could do.
Okay, I think that's, what I tell patients is that the only wrong choice is not to pick a medicine. The odds of succeeding without medicine are very low compared to, medication just increases your chance of success. And in some ways, I don't want to say it doesn't matter what medication you choose, but I'm more concerned with somebody picking one of the medication choices than not picking. So buprenorphine, if that's what you want to do, that's a great choice. And listen, if it doesn't work out for some reason, we can always switch to one of the other options. So the way that we would approach this to get this started is that I will write a prescription for the smaller pills or tablets. The pills will probably be cheaper if you're paying out of pocket for it. And what I'll do is I'm going to write a prescription for a quantity of the 2 milligram pills. You're going to fill that, and then you're going to bring that in tomorrow. What I want you to do is I need you to come in the morning in a little bit of withdrawal. So usually the way I get people to do that is that they will use their last dose of heroin or oxycodone, whatever they're taking, like around 8 o'clock at night, the night before. And then I'll give you something to sleep. Like, have you ever taken trazodone?
No.
So something like trazodone, or maybe a low dose of, have you ever taken something called Seroquel or quetiapine?
No.
Okay, so I'm going to give you something, probably give you some trazodone. I'll give you 50, or you can even take 2 of them, take 100 milligrams of trazodone to help sleep. So, if you go into withdrawal during the night, that hopefully you stay asleep. And I want you to come in, when do you usually use last at night? Like, when's it?
Like 9,
okay.
9:30.
And then what time do you get up?
Usually around 7.
And do you feel a little sick?
I mean, I wake up during the night, but I typically won't use during the evening.
Okay, so it might not even be that hard for you to do. It might be not that different.
Okay.
So the only difference is that you probably use as soon as you get up normally.
Yes, first thing.
Right, so you're not going to do that. You're going to come to the clinic, and then you're going to bring the buprenorphine, and then I'm just going to do like a quick rating scale. I'm just going to ask you some questions and just measure how much withdrawal you're in. And then as long as you're having like, at least some mild to moderate symptoms of withdrawal, we'll take the first buprenorphine tablet. If you're not in withdrawal, then we'll wait. And so the experience that you had when you used that non-prescribed buprenorphine, which was you precipitated some withdrawal, as long as you're in some measurable withdrawal, you'll be fine. And then throughout the day, we'll increase the dose gradually until you feel okay. And then usually what I do, there's no one right way to approach this, and the dosing is very particular to you. So you might need like a relatively low dose and feel totally comfortable, in which case that's great. Or you might need a higher dose to feel comfortable, in which case that's what we'll do also. Usually what I do is we'll add up how much buprenorphine you got that day. So like if tomorrow is day 1 and you took 4 of the 2 milligram tablets to feel comfortable, usually what I have people do is start the next day with that at 8. And then we, usually we'll continue like that for a couple of days, and we'll kind of sometimes increase it or decrease it depending on the person's feeling. So it's actually not that complicated, and a lot of it is going to be, the dosing is going to depend on how you feel, and our target is going to be to relieve withdrawal symptoms, relieve craving, but not induce, like if you take too much, it doesn't feel good to take too much, like it can feel like a little spacey, and you probably won't like that. And the other symptoms that people commonly have is like some constipation or just kind of feeling a little out of sorts. So we're not like, more is not necessarily better. We're going to try to adjust the dose to kind of meet how you need. And then we'll go on like that. And we'll be doing some urine drug tests just to make sure that you're taking the buprenorphine. Initially the drug tests are going to be positive for other opiates, but then would expect for that to change. and we'll see how it goes. And we'll also be talking about what kind of behavioral treatment would be good for you to be engaged in while you're getting the medication treatment. But we're going to start the medication treatment first to kind of get the ball rolling.